Hello, I'm Dr. Brian Haas. I want to welcome you to my thyroid presentation. There's no question or no doubt that you're watching this presentation because either you or one of your loved ones is suffering from a thyroid condition. And whether that's hypothyroidism or hyper, maybe you've been diagnosed with an autoimmune thyroid called Hashimoto's thyroiditis. In this presentation, there are many things that are enlighten you about what you don't know about your condition, what lab tests that haven't been done, why your lab tests are quote-unquote normal, yet you're still suffering with hypothyroid type symptoms or even hyperthyroid type symptoms. And this condition has gotten worse, even being on the medication and being prescribed different medications, let's say over many years now. And your doctor's kind of throwing their hands up in the air and they don't know what to do because, again, quote-unquote, your lab tests are normal. So you're here to find solutions, you're here for a different approach, and you're here to find an answer and a solution. Okay, now let's talk about what the thyroid gland supports and how important it is to your entire system. Every single cell of your body has a receptor site for the thyroid hormone. And you look in here, this whole thing here, you can see that the thyroid supports your bone metabolism. It's imperative that your thyroid's working right so that you have proper immune system function, brain and nerve system function. It controls and helps work with the adrenal glands, your ovaries, your testes, your reproductive organs, gastrointestinal function. Even liver and gallbladder have to work and function properly as long as the thyroid's working function properly. Fat burning, this is the big thing for a lot of people, is that your thyroid gland produces the hormones to control your metabolism. And those hormones are released to turn on the cell, turn your cell on to control, and it's the key or the ignition to your cell. Extremely important for that reason as well. Insulin and glucose, that can control and cause different hypoglycemia. You can have insulin resistance. A lot of my diabetic patients have trouble with their thyroid and have thyroid conditions. Getting into cholesterol levels and even stomach acid. Again, folks, your thyroid gland is extremely important to function appropriately so that you are healthy. Every cell in your body has a receptor for thyroid hormone.